Hello, I'm Harold Jones, Dean of the School of Health Professions at the University of Alabama at Birmingham. Thank you for joining us for another discussion in our continuing series where we interview experts from our school. Our experts are leaders helping to shape the future of healthcare through tailoring innovative solutions to real-world problems. Today we're discussing the UAB Healthcare Quality and Safety Graduate Certificate. This certificate is a unique multidisciplinary approach to the analysis and solution of complex problems and prepares both clinical and administrative professionals to deploy quality and safety-focused strategies within their organizations. With me today is Dr. Donna Slovensky, an Associate Dean in the School of Health Professions, who serves as the Administrative Director for the Healthcare Quality and Safety Program. Also with us is Dr. Scott Buchalter. Dr. Buchalter is the Vice President and Chief Strategy and Quality Officer for the UAB Health System and serves as the Medical Director for this certificate program. Thank you for joining me today.
Very glad to be here.
It's my pleasure. We're happy to promote this certificate program.
I think all of us know, or at least have some idea of what quality and patient safety might mean in the healthcare arena. However, I'm interested in knowing, because we're talking about the development of a certificate program, about specifically how you're defining healthcare quality and patient safety for purposes of this type of program.
10 or 15 years ago, I would say it wasn't clear how we define quality, how to measure it, and therefore how to improve it. Now, over that span of time, we've really developed more specific definitions.
I think patients are far more focused on the interaction with their clinicians and with their other providers, and they are more concerned about the interpersonal relationships, where we also need to be concerned about clinical outcomes and use of technology and the way things are organized.
One of the follow-ups to that, I think, also is our recognition that engaging patients in the care delivery process is critically important, because engaged patients and families are able to participate in care decisions and actually the processes of care. And what we found over time is that that improves outcomes as well. So it's really a team sport, so to speak, where everybody participates in care.
I think we would all agree, based on what you've talked about, that healthcare quality and patient safety is very important and an important part of our health system. Are there, though, drivers that are making this a more important topic, or one that people are more focused on today than maybe they were a decade ago?
Healthcare is shifting dramatically. We're in a transition in this country where the government, Medicare, CMS, other payers are no longer going to simply pay for something you do, but rather pay for value, good outcomes. And that's important because we will not reduce the cost of healthcare in this country, which is critical, if we're not able to produce efficient, effective, good outcomes, and we won't get paid for it.
I think the complexity of healthcare generally is a huge driver. The more we are able to do for patients, the more opportunities there are for making medical errors and for having things go wrong. So our ability to do more has also increased our ability to do things less well than we want to. And patients, I believe, are more aware, because there's a lot of public information made available, and patients are more information savvy than they used to be. And we have opportunities to make comparisons among providers.
So we all, I think, would agree that healthcare quality and patient safety is important, and we can see from your answer that there are reasons why there's a special focus on that today. But what is it that drove you to think about the development of a program or a certificate program in healthcare quality and patient safety here at UAB? And how did you go about choosing the School of Health Professions as your partner in the development of this certificate?
Quality improvement is really the science of managing the processes of care delivery that go on every day. And I like the concept that all of our nurses, physicians, and leaders need to spend 95% of their time doing their job and 5% of their time improving what they do. And there is a science and a methodology and a set of knowledge that most folks in healthcare systems don't actually have, and the idea was to begin to create individuals that lead in the system to do that.
Since healthcare quality and patient safety is important across the board, and you've talked a little bit about this and about the certificate program, who are the audience or audiences that you're particularly trying to reach with this information?
Everybody who's involved in patient care needs to be involved in improving the quality of patient care. Now, that being said, there are various levels of training that individuals need. What we are trying to reach, particularly with the certificate program, are those who already have a fair amount of experience in working with quality and safety activities, but who we believe we can add a more formal structure and a driver toward evidence-based solutions. Where often in the healthcare organizations that you get into a project, because you know the process, you're very quick to jump to the solution. So part of what we're trying to do is teach these individuals, begin with what is known, begin with the body of knowledge that exists, and study that in the context of this particular organization, this particular situation, and work through this analytically to arrive at the best solution for this situation.
You have a number of people who are participating, particularly in the early stages of this program, who are very senior leaders in the healthcare system. I mean, these people bring decades, in many cases, of experience to the table. They have medical degrees, some of them are Ph.D.s, but the bottom line is they're very experienced, very well-educated people. What is it that those individuals are seeking to learn as part of this educational experience?
It is difficult to improve care delivery, and there is a methodology, as Dr. Slovensky has said, that one can learn, and they want to be able to not just talk the talk, but walk the talk. And so learning the details and the methods to implement change is critically important for them, and that's a large part of why they want to participate.
Without a formal structure, many of the teams have just been working toward the problem when they have time. This has put them in a framework where they work through it in a systematic fashion of looking at the evidence, working directly with the team to go through the analytical components. And I think many have expressed some concerns that previously they didn't feel their analytical approach was robust enough. And by working through a project and being given directed feedback on the analytical components and how that leads to the solution has been a good response.
What we have learned as many leaders come through this program is that there is a networking component to this. Leaders in the class meet other leaders that they perhaps would not have worked with. And we have found that across the system, the campus, and I'm sure probably in broader ways, as the class expands, they actually began working on things outside the class because they now are able to communicate with each other and learn other areas of care. And it's spawned a lot of that kind of activity, which is great for a care delivery system.
You've already started to talk a little bit about what the content is of the program that you're delivering. But could you give us a little bit more of the details of the curriculum and what's covered as part of the certificate program?
We deliberately integrated the components of those courses so that it works as one big piece. There's one course that is focused on the foundations and infrastructure of quality improvement activities. We have one that is measurement and analytics, one that is patient safety, and the final course is leadership, which of course you've contributed to as a presenter. So we've tried to use this integrative approach that a project that incorporates all of these needed components pulls all of those concepts together.
I've noticed that even though this is a program that was put together by the health system and was put together with the School of Health Professions, that there are a number of instructors who come from various parts of the institutions, from other schools, and indeed there are instructors who even come to the program from outside of UAB. Why did you decide to utilize such a broad group of instructors, and how has that collaboration gone?
Of course, we're incredibly fortunate that on this campus There are large numbers of highly skilled people with the knowledge and the ability to deliver that knowledge that we needed. We're also fortunate that Dr. Buchalter knows almost all of them and was able to negotiate their participation in these classes.
You know, one of the concepts that we teach in the class is that of a high reliability organization. And one of the sort of hallmarks of a high reliability organization is allowing those with the expertise to teach or be part of the process, and we have tried to model that. So when we talk about components of either quality improvement or methodology or statistics or the analytical pieces of variation or patient safety, we went around the campus and said, who are the best teachers? Who has the best content knowledge?
You have completed the education of the first cohort of students and almost the second cohort of students. What are the things that you have learned to this point from them that have made you think about what you might want to do differently in the course? But most importantly, what has been the feedback from this group of individuals who've been to the program at this particular point?
The students like the team focus. They really like working in teams for their course deliverables.
This is an intense learning process, but the students rapidly grow in their ability to understand the science, the methodology for quality improvement. And the feedback I get is they immediately go back into their microsystems, their areas of work, and begin to implement things that they've learned in the course.
So it appears you have an excellent program, a program that you're getting extremely good feedback about. But on the other hand, there have been small numbers of students so far that have gone through this, and you have mentioned the fact that it's important for everybody in the healthcare system to play a role in healthcare quality and patient safety. So do you have any plans for expanding either the breadth of what you're teaching to give people more depth, or to reach out to other audiences other than those at UAB?
Our plan has always been to implement a master's degree that is an extension of the certificate, and that proposal is currently under review. We expect that it will be open for implementation in spring of 2015.
I would say well over half that we've spoken with desire to move on into a master's program. And I would say, parenthetically, that there are very few programs like this certificate program in the country, and even fewer master's programs in healthcare quality and safety. So that's a huge advantage for us to be able to provide that for those leaders who want that.
We've been approached by several healthcare organizations. When are you going to open the certificate beyond the health system? We would like to send cohorts of students in ourselves so that they work on projects in our organization. So we believe there is an option for us to go either with cohort-based groups from individual healthcare organizations, but eventually to open it to the community at large.
I think that good leaders of health systems, for example, are recognizing that costs have to go down and value or quality and safety have to improve and go up. And they recognize that in order to do that, there is a set of content knowledge that one has to be cognizant of to be able to make those things happen. And so they're hungry for this kind of information because it really doesn't exist in a formal way in most training programs.
Thank you again, Donna and Scott, for this exciting information about this wonderful new program that's been developed, and thank you for sharing your time and your expertise with us today.
Thank you for having us.
Thanks for having us. It's been a great partnership, and we look forward to our coming classes.
If you would like more information about the program, visit uab.edu/HQS. If you have questions for the program, you can send an email to them at shrp-gchqs@uab.edu. And if you would like to reach out to our school, visit uab.edu/shp/contact. Thank you again for your time and for joining us. I'm Harold Jones, Dean of the UAB School of Health Professions. where we are shaping the future of healthcare by tailoring innovative solutions to real-world problems.